The Medical University of South Carolina announced that it was partnering with the Center of Disease Control in preparing South Carolina for an Ebola outbreak.
South Carolina's approach, which is very similar to many other states, is what we've realized is that we probably need a small repertoire of caretakers that are highly trained to take care of an Ebola patient should they present. And so that's basically what we're doing at the state level, is reducing the repertoire of facilities that are trying to get Ebola prepared in the sense of long-term care of an Ebola patient. So the model of care will end up looking something like if a suspected patient presents somewhere in the state, in consultation with DHEC, we would make some decisions about how suspicious are we based on the screening criteria, and then working with the CDC, if the level of suspicion is high enough, then the patient should be tested.
After a positive test, the patient would be transferred to MUSC, where a highly trained team of volunteer health workers would provide supportive care.
Here at MUSC, we're also doing simulation training, because once you have the gear on, it's actually much more difficult to do simple tasks such as drawing blood or starting IVs, things that normally would be extremely easy for a trained nurse is made much more difficult just by the character of the gear that's required to protect that healthcare worker. And when people ask, you know, is MUSC ready, or is Greenville ready, or is Palmetto ready, it's not a yes or no answer. I mean, I think we're all on a spectrum of readiness, and the more days we have, the better we're going to perform. But I do think we're all pretty far down the trail leading to Emory level care.
For Palmetto Scene, I'm Katie Geer.